Introducing the Perimenopausal podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Perimenopausal podcast.
Hey, this is Doc Yates, and welcome to the Perimenopausal podcast, brought to you by perimenopausal.com and ablehealth.us. And today, I want to talk about the pain in your neck, because having a pain in the neck basically is a pain in the neck. And it's something, the reason I'm doing it is because I see this a lot in my perimenopausal patients. So, chronic neck stiffness, people that carry all their tension in their neck, and generally the only solution they often get, painkillers, muscle relaxants, which is not addressing the root problem. So today I want to break down 5 tips that you can use to help with if you have chronic neck pain, or if you have, especially if you have chronic tension headaches related to the neck pain, because a lot of times it's always about finding the next step, finding the next underlying issue. If your headaches are due to neck stiffness, then we got to treat the neck stiffness. If your neck stiffness is due to these things that we're going to discuss, then you got to address these. So let's break into it. We're going to jump right in. Number 1, stress and the weakest link. So a lot of people get stress and it doesn't affect their neck at all. Sometimes it affects their digestion. Some people it leads to palpitations. Some people it disrupts their sleep. But for a lot of people, they carry all of their stress and their tension in their neck, which means part of it is reducing your stress. So if you have stressors that you can identify and you can remove them, then I don't know why you're not doing that right now. You can just stop the podcast right now, go find those and get those addressed. You always want to get to the root cause of things. If the stress is a big issue, deal with the stress. And we have some other podcasts on how to do that. But remember, this is exposing the weak link, which comes down to point number 2, posture and strength. So a lot of times people think that because a muscle's tight and stiff, it's probably not because of weakness, it's just because it's too strong. And I have found, though, in practice, that it's usually there's a weakness that is leading to the tightness, not because it's too strong. Not too many people, especially too, it's not like I don't see a lot of perimenopausal females who have super big, thick, strong necks. It's not like they're out training, like they're going into wrestling or something like that. It's usually because of weakness and because of posture. The most common posture issue is that we all face is because of desk jobs and computer work. So if you can try and make sure that your desktop or laptop that you're working at is sitting at a higher position, so that when you're sitting, you don't have to be looking down and leaning forward, that will take some of the strain off of your neck and improve your posture. Females, a lot of times too, I have found that females, sometimes it's because if they're bigger chested, that puts a lot of strain through their shoulders, and anything that pulls your shoulders forward will lead to tension in your neck, because the moment your head goes forward, your shoulders go forward, and vice versa. You can't really sit up straight with your shoulders rounded forward. Other times, females that are more, it's like if they are big chested, they're trying to kind of hide that fact, and they roll their shoulders in as if it's gonna not show that as much. Same thing. Anything that's pulling your shoulders forward, carrying your purse always on your same shoulder, pulling that forward will lead to a forward shoulder posture, a forward head posture, and to neck stiffness. So point number 2, be very aware of your posture and the tendencies that you have, whether it's working, carrying a purse, the way you're standing always holding the phone with your head. Be aware of those things and the role that they can play with your neck. And from the strength standpoint, I have found if you could do, you don't need to go out and do things like neck bridging or anything like that, but doing some neck strengthening exercises, and especially strengthening between your shoulder blades. Doing light strengthening exercise, but being consistent with that helps quite a bit. Most of the time, you need to stretch out through your chest and do the strengthening through your mid-back and we call like the lower traps, like the scapular stabilizers, those are called. And when you get those strengthened, you will see much less stiffness in your neck, and you'll see less episodes of stiffness in your neck. Number 3, a third tip that you can use to help if you're dealing with chronic stiffness in your neck: supplements and herbs. Number 1 supplement by far, magnesium. And as I've said before, magnesium for all. Like, you just take magnesium before bed. If you have someone who deals with muscle tension, no matter where it is, whether it's your neck or not, take magnesium before bed. Other things that can play a role: I use a lot of herbal formulas. Some of these take a little bit more to mix, but cramp bark is a great one. In our magnesium, our Mag Plus formula, we use cramp bark as the filler, so it's like a 2-in-1. The other thing that you can use, there's an herb called lobelia. This is something you'd want to work probably with a naturopath to use. It's a little harder to dose. Interestingly enough, black cohosh. So black cohosh, which is typically used as a female herb for hot flashes, that's kind of how it's been labeled, was used for neck tension. So I use that in my neck tension formulas, because then if I'm using in a perimenopausal formula, I kind of kill 2 birds with 1 stone. Dioscorea is another similar herb. It has a great effect for relaxing your neck muscles, and it also has a good effect for hormone balance in perimenopause, so that could be a great herb for you to pick from. And let me think if there's any others. Any other ones, it depends on the time of day you want to take it. Like if you're taking it as a sleep formula, you could use something like valerian and passion flower. They work good for muscle tension, but those ones are a little bit more have a sedative effect, so you'd want to take those before bed. But the point is, there's a lot of great herbs that you can use to help with muscle tension and neck stiffness. The next thing I want to mention would be manual therapy. Manual therapy is something you'd probably be more familiar with. The thing is I want to break down is that when you're getting manual therapy done, so I'm going to give some examples. Manual therapy would be like massage therapy, physiotherapy, osteopath, acupuncture would be included in that, chiropractic would be included in that. Getting those treatments done can be extremely helpful in managing chronic stiff necks. So generally, I have found, at least where I practice, a lot of people are set up with the way their health insurance works is that they have, X amount of coverage for acupuncture, X amount of coverage for osteopath, X amount of coverage for massage therapist. And I tell them, break it up. If this is something that this is your weak area, then maybe once every 6 weeks you get a massage. But then those in-between weeks, maybe you get an osteopathic treatment done. And then those other in-between weeks, you get an acupuncture treatment done. So that way, every couple of weeks, you're getting something done to help loosen up your neck. I would say, though, that if you're seeing any therapist and you're dealing with chronic stiff neck, and the only thing they're treating is your neck, you should probably find a different therapist. Because a good therapist should be able to find some of these other imbalances I was talking about earlier. Like, they'll probably should be able to find that maybe you have chronic tight jaw issues. Maybe you are tight through the chest. A good osteopath or a chiro would find, maybe you have ribs that are not moving properly in your upper back. And those, because the neck muscles attached there, are leading to those to be chronically tight. So you want to work at it, or they should be working at it from the full picture, not just dealing with your neck. So if you go there and the only thing they're focusing on is your neck, they've got to be looking for other spots. The last thing I would say, and we've talked about this many times before, but the anti-inflammatory diet. I've had a few patients who had chronic neck issues and chronic headaches, and we would treat them, and we'd give them magnesium, and then we would treat them with acupuncture and osteopathic, and they'd feel great for a little bit, and then it would just come back. And then we would treat them, and then we'd feel great for a little bit, and then it would just come back. And in those situations, there was some inflammation that was related to their diet. It could be any one of the inflammatory foods, so I can't just say, oh, just avoid this one thing and that's it. But sugars, I'll list them off, the top ones that I've seen. Sugar at the top. Gluten would be up there. I've seen a case where when the person finally, they cut out dairy and all their neck tension went away. I've seen one for peppers, which is a nightshade vegetable. They cut that out and their headaches and neck pain all went away. So if you're stuck, I wouldn't necessarily start with a really restrictive diet. If neck tension is one of your issues, I'd probably deal with the first 4 points first. But for the 5th point is if you've done all of those things and it's still an issue, consider trying an anti-inflammatory diet. I've seen it in those cases that are stubborn cases. So those are the information. That is the information, 5 quick tips that you can try to help deal with a chronic stiff neck. Stiff neck. There we go. This is Doc Yates signing off. I hope this has been helpful. Bye.
Thank you for tuning in to the Perimenopausal podcast. Don't forget to hit the subscribe button and visit perimenopausal.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Perimenopausal podcast.